and welcome to our webinar, Where to Start, Helping Your Aging Parents Plan for the Future. I'm Jason McKnight, and I've been working in the senior living industry for over 13 years, 11 of those with ACTS Retirement Life Communities at Magnolia Trace in beautiful Huntsville, Alabama. I'll be your host today to help you learn more about senior living and explore all your options to prepare you and your loved ones for this journey ahead. Let me ask you this. When was the last time you talked with your parents about their plans for the future? Do you know what those plans are, if they even have any? Understanding your parents' wishes now rather than later is one of the most important things you can do. Taking the time to explore your options today can help prevent stress and uncertainty down the road. We know how overwhelming it can feel at first. We've been there too. Today, we'll share how to approach these conversations, what questions to ask, and how to feel more confident as you support your loved ones. Joining me today is my colleague, Gina Botters, a sales coordinator who not only works in senior living, but has also walked this journey personally.
Thanks, Jason. I've worked in the senior living industry for the past 3 years, but my journey began about 8 years ago when I began caring for my mother-in-law with dementia and now my father who has Parkinson's disease. That experience opened up my eyes to just how complex and emotional this process can be. It's what inspired me to help other adult children plan ahead and feel more prepared than I was at the time.
And that's exactly why we're here, to help you plan and make informed choices before a crisis hits. So let's start with some basics. Understanding the different types of senior living options can go a long way in helping you find the right fit for your loved one's needs. Here's a quick overview. Independent living is typically for older adults who can live on their own but want a lifestyle free in a retirement community without the burdens of home maintenance.
Independent living could be a house, a cottage, or an apartment. Social connection and convenience are key benefits here. And then there's assisted living. If your parent needs help with daily activities like bathing, dressing, medication management, or meal preparation, assisted living provides that extra support in a residential setting while still encouraging independence. Memory care is for individuals with Alzheimer's or other forms of dementia. Memory care offers specialized support in a safe, structured environment tailored to cognitive needs.
Then there's in-home care. If your loved one wants to remain in their home but needs assistance, professional caregivers can provide support with professional care, housekeeping, and even medical needs right at home. Skilled nursing or long-term care is a level of care for individuals with serious medical needs who require around-the-clock nursing care and supervision.
Then there are continuing care retirement communities, CCRCs. These communities, like ACTS Retirement Life Communities, offer all of the above levels on one campus. Typically, a person moves or a couple moves into independent living, but has access to assisted living or skilled nursing if they ever need it without having to pay extra for more support.
Now that we know these senior living terms, we can talk about real-life scenarios. And one of these is a story that comes from Gina herself. She's navigated this journey with her own family, and it's shaped the way she helps others today. Gina, tell us a little bit about your family's experience.
In our particular case, we were unaware of some early onset dementia with my mother-in-law. In the middle of a military move back to the state of Alabama, we realized that my father's health was failing, and he passed away. So the care for my mother-in-law began at that time. We did not have any information on her medical background. We needed to go and meet with her doctors to find out where she was in her journey and what her medical needs would be. We also needed to find out where all of their accounts were. My father-in-law had a meticulous ledger, but as he declined in health, so did the ledger. Everything was on paper, so we needed to contact all of their banks, investments, make sure that we had an account of all the bills for the home. It was quite the undertaking that took several months to both find out where all the money was and how much income they had and what her specific needs were personally.
Would you suggest being on your parents' financial accounts? Why or why not?
Absolutely. If they are willing to add you to, especially their checking account, so you have access to that in case of an emergency, that would be the most beneficial to you. Other than that, you would need to be a power of attorney and have access to their accounts, investments, banking, and other types of financial information.
Do you think that your parents may benefit from keeping or dropping the long-term care insurance policy if they have one?
Long-term care policies are very different. Each one have different rules and regulations. And I know that you, Jason, have a lot of experience in this area.
I would recommend getting an updated policy from whoever your insurance agent is and going over it yourself, or maybe sitting down with a financial or insurance advisor on what benefits you have and whether you should keep it or not. So with each policy being its own entity, you really need to check it yourself. Kind of sticking in the policies area, Gina, what legal documents should your parents have and what access should you have to them?
Legal documents are one of the most important things that you're going to need for your parents. And there's many of them that you need to make sure that you have. The first one is the last will and testament. It outlines how the assets are going to be distributed after their death. Second is a power of attorney for financial. This allows the person to manage the parent's financial affairs in case they are incapacitated or just unable to do so themselves. The third document is a healthcare power of attorney or a healthcare proxy. This designates someone to make those medical decisions for them in case they are unable to make that decision for themselves. Then an advanced healthcare directive or a living will specifies their wishes regarding the type of care that they want toward the end of their life. There are a lot of other documents that may be pertinent to your specific situation with your family. So please be sure to contact a reputable elder care attorney in your area to make sure that you have all the documents that you need to keep your loved one safe. Once you have all of these documents in place, you would need to have access to them. Your parents can either keep them in their safe at home if they don't want to share that information with you, but you know where they are and that you can get them quickly in case of an emergency. Or if they're willing to share that information with you, you should keep copies of your POA with you at all times in case you need to implement that in case of an emergency.
What about a living will or an advance directive?
Both of those are very important to have on hand. The living will is something that you would need to discuss in advance, as well as an advance directive. These are not documents that you want to address in the middle of a crisis. Many times, adult children go home for the holidays or they go home on vacation and they realize that their family members might be declining. And that is not the time to bring up legal documentation. Parents can become very defensive, and maybe they're not thinking clearly at that time. So these questions and these items need to be addressed well in advance. And they're not questions that you need to discuss all at one time. You want to think of it as micro conversations. Mom and Dad, do you have a plan? Okay, well, can we talk about that plan next week? I would love to go over some documents. Why don't you and Dad pull the files out and let's make an appointment and I'll come down and we'll have lunch and we'll go over those documents just to make sure everything's in order. You don't want them to think that you are taking over their care or their finances. You want to come alongside and help them in the best way possible.
You mentioned advocating for your parents a couple of different times there, Gina. How do you become a legal advocate for your parents?
That stems from the power of attorney and the advance directive. You draw from those documents how your parents want you to advocate for them. You also should have a journal of discussions that you've had with your parents. What are their wishes? Where are their burial policies? Where are their IDs? What is their PIN number for their phone in case you need to get into their phone and call friends or family or pastors? There are so many little things that you don't think about during a crisis, and the time to gather that information and to help your parents the best is to have these conversations early and often.
I agree. There's no time like the present to start these conversations. Let's take a situation. I've noticed that my parents' cognition has started to decline. So how can I help advocate for them?
The first thing to do is to make an appointment with their doctor. It's very important to get a diagnosis and a baseline of where your loved one is in their cognitive journey. The doctor may be able to recommend some medication as well as speech therapy. There are lots of ways to delay that cognitive decline if you know what's going to be best for your family members. And then you want to pursue those doctor's appointments, follow up with your family, find out where they are at home as far as being able to care for themselves, make sure that they're being safe. If they're not safe, you need to make some arrangements for them, whether it's bringing in home care temporarily or long term. And then you need to begin looking at senior living communities, whether it be independent living to start off with, which would be the preference. So those independent living individuals, get to know them and their personality before they decline further. If you're past that point, then you need to seriously look into memory care communities and find out which one is going to fit best for your family.
When these issues come up, there are a lot of different options for parents. Would you mind going into maybe some of the senior living types of options that are available?
Yes. Personally, with my mother-in-law, we were in crisis mode. My father-in-law just passed away, and we did not know that she had any cognitive issues at all at that time. But as the 2 or 3 months passed, we realized it was not safe for her to be in the home alone. We looked into sitter services. We also began touring senior living communities in the city that she was living in. We determined that we thought that she could benefit from independent living with a little bit of assistance. So her first move was into an independent living community. We added a little bit of assistance that could come in and do medicine reminders, that could come in and remind her about different activities. And that was great for a while. But with any plan, you always have to make adjustments. And through her journey, as she began to decline a little bit more, we looked into finding a memory care area for her. And we found a memory care community close to our home. So that was a big move for her, moving from her hometown to be closer to our family so we could keep a closer eye on her. During the process of finding a memory care community for her, we found one that met all of her needs. The issue then became that she was declining physically. And as she began to fall and have other incidents, we needed to find another place for her to move. Many times when you're looking at fee-for-service communities, they're very compartmentalized. You can move in independent living, but then if you need assistance, you pay more for that service. If you need memory care, you pay a little bit more for that service. If your needs become so great that you need additional care, sometimes you have to move out of that assisted living or memory care community into a higher level of care. And then that adds an additional cost to that care. That is called a fee-for-service community. There's also a community called continuing care retirement communities, which is what ACTS is. That means when you come in as independent, you're able to transition to different areas throughout the community as needed. Continuing care communities have all 3 levels of care along with rehab. So your options are endless. You're able to move within that community for the rest of your life. So those are the two different types of senior living that you can consider when looking for your loved one.
Why should you consider a senior retirement community, either style, a fee-for-service or a Type A contract, the way that ACTS is?
I believe the senior living communities are a wonderful choice because you have that level of care that is consistent. We have worked with families that had sitters come into their home, and although that is a great option, they are human and things happen. So if they're not able to show up because their own children are sick, or if there's a snowstorm outside and they aren't able to get to your family's location, what is your backup plan for your loved one? You always need to have plan A, B, C, D, and E when it comes to caring for your parents, because sometimes the first three don't work and you need to go to plan D and E.
I think we've all had to go to plans D and E from time to time, Gina. That's a great point. And you mentioned home care. What does home care entail, and how does it benefit the client and their families?
In-home care means that sitters can come into your home and help your loved one with their daily tasks. They can cook and clean, help with medicine reminders, get them dressed and showered for the day. Each in-home care company has different requirements. When you're interviewing them, which I suggest you should, find out what the requirements are, what they can and cannot do. Some of them cannot transport your loved one to doctor's appointments. Some of them are not allowed to sort the medication. Those would be things that would fall on the family. So you need to know those areas up front, because if you are dealing with having an in-home care company come to a loved one's home and that loved one is out of state, what is your backup plan? Who is sorting the medication for them? Who is going to transport them to those doctor's offices? They're a great advantage to have your loved one stay in their home, but you need to know all the details up front.
It sounds like that could definitely benefit some families. So how would you pay for something like that? What would payer sources be?
Of course, the payer sources vary. You are able to pay out of pocket. It is not covered by your insurance, your medical insurance. It is covered by some long-term care policies. Some of them do allow for in-home care. That is, you would need to utilize that. Usually there is a 90-day elimination period, which means that you would need to pay for those services for the first 90 days. And then after that, they would begin paying for that through your long-term care policy. Otherwise, it is an out-of-pocket cost. It runs currently in the state of Alabama, it runs around $30 to $35 an hour. So it can be cost prohibitive to some people. And the only disadvantage I see through in-home sitters is they are human. And sometimes they're not able to show up for work for reasons like their children are sick or there's a snowstorm outside. You always have to have those backup plans for those sitters.
Excellent points. And speaking of payer sources, some of us have to rely on government assistance or Medicaid. So when should I start consulting a legal advisor about the possibility of Medicaid?
Well, no one likes to talk about money, especially your parents. But this is the most important conversation you need to have with them. Medical care is extremely expensive. And when you begin researching the different avenues for senior living or in-home care, you're going to see a large variety of costs. If your loved one needs to move into a skilled nursing facility, in the state of Alabama right now, it runs around $11,000 a month. If you think that your parents' funds will diminish during that time, that they will need skilled nursing, you need to begin talking to an elder care attorney now. You cannot start meeting with them early enough. They have advocates within elder care attorney law firms that will help with the Medicaid process. You need to locate those individuals, and then you need to come up with a plan. Medicaid has a very strict policy on what is allowed to be used for funds as you pay down to apply for Medicaid. They have rules and regulations if it's a single person versus a couple. These days, you don't have to draw down to the $2,000 mark like you used to. If you have a couple and a spouse is still healthy and living, they are able to keep a percentage of those family funds. But if you're not spending down properly, they are going to look back 5 years into your finances. So you want to make sure that you're doing due diligence and applying for Medicaid in the right way. And a lot of times you need the assistance of an elder care attorney to do that.
And getting assistance can be huge. And we were just talking about payer sources, and I know a lot of us, our parents were in the military. So how do I check what benefits they might have that could help as a payer source?
Absolutely. The VA office is where you would need to start. Most cities have a VA office that is a local entity. It's best if you can go in person or make an appointment to talk with an advocate there. They will review the discharge paperwork and the years of service. There are certain requirements needed in order to apply for VA benefits. If you meet those requirements, then they're able to help you fill out the forms and get the approval for those services. Sometimes there are benefits out there that you don't know you are entitled to. So I highly encourage that you go to a VA specialist in your area to discuss all the different ways that they can help. There are sometimes VA hospitals near you that would help with doctor's appointments. And then there are VA homes, which are long-term care nursing homes. Those are located in certain cities, and it's a significant savings. Here in the state of Alabama, long-term care, like I said, is around $11,000 a month. A VA home long-term care would be around $300 to $400 a month. So it is a significant savings if your family member is eligible to live there. The drawbacks are that it may be a semi-private room and the spouse of the veteran is not able to live in the home. These are lots of details that you'll find out when you meet with your VA representative.
Excellent information, Gina. I know that those of us with parents who have veterans benefits, that can definitely be beneficial. So the question really boils down to, when do I need to start having these conversations with my parents?
Yesterday. If your parents are moving into their retirement years, you need to begin having these conversations now. And it's not, like I said earlier, they need to be micro conversations. It's very easy to get overwhelmed with the information that is needed to advocate for your parents and to help them through these next few years of their life. Make sure that you have a journal and you're keeping notes, and go through the guidelines that we have set in this webinar. And you should be on the right track to have everything in place prior to any kind of emergency. When you become an adult child advocate for your parents, it is not an easy task. Through my experience with both my mother-in-law in memory care and then my father-in-law in skilled nursing for Parkinson's disease, this becomes your part-time job. And some people, it becomes your full-time job. It depends on what level is needed for your family. And you can't do this alone. You need a team of advocates that will help you in each one of these areas of healthcare, legal, personal, additional support through healthcare companies, whether that's senior living or in-home care. You need to build your team of trusted advisors throughout this journey. And you also need to build your personal team of support your family members, your spouse, because it affects everyone that is a part of your family and a part of your life. Having those trusted friends and advocates to help you through this season of life is a benefit that is just immeasurable.
Thank you again, Gina, for being with us today and sharing a little bit of your journey with your family. And we would like to let everybody know that the information that we are relaying may relate to the state of Alabama. So we would encourage you to check with your own personal state, because some of these laws and regulations are state specific. So go on ahead and check with that elder law attorney in your own state about what may apply to you. We appreciate your attendance, and we hope that you have learned some beneficial information for yourself and for your family.